Bouncing around the internet on this overcast, dull August bank holiday, I noticed this from October 2016, a BBC article. I know, so it must be true. And it goes into waste. And now I would have thought that commenting on waste by the BBC was a bit like throwing stones in a glass house, but fair comment. They have at least addressed the issue. £118 billion is spent in the Department of Health. That's 5 years ago now, so you can bet it's an awful lot more than that now. And in football terms, of course, because the BBC, that would buy 1,200 Paul Pogba, whoever he is. The most expensive football player on the planet. Well, there we are. Obviously, they're trying to couch it in such a way that, look at that. These footballers, they only buy 1,200 footballers. They then go to say how it's spent. 118 billion, 17 billion sliced off by the Department of Health. So that's for Whitehall. 17 billion pounds for admin in Whitehall. Billion. 17,000 million pounds. They then give 90 billion to hospitals, GPs, mental health services, in other words, the NHS, ambulance trusts, the things you'd expect the money to be spent on. So what happened to the rest? Both that held by NHS England and the Department of Health. Plenty, you could argue, they say. Went to the front line via other routes. Over 3 billion went to councils to pay for public health services, such as stop smoking services and sexual health clinics. So basically duplication. But let's have a look at 2021 and actual jobs being advertised by Indeed for NHS-related positions. NHS Test and Trace, well, there we go. We all know how many billions are being spent on this. Operational Improvement Manager, process. Based in London, but you work remotely. Okay, so you're working from home. £500 to £550 a day. So what's that? £2,750 a week. About 11 grand a month, is that right? 272 for 8. Yeah, about 11 grand a month. So 11 grand a month to be an NHS Test and Trace operational manager for London. This is just London. So we ought to have a look at this and see what actually they do for the money. 7 individuals in this delivery unit. They will be building and maintaining a process taxonomy of all PTM operations and processes, working with fellow ops improvement colleagues. So, working with your colleagues. That's normally what you do when you're at work. Proactively new skills. What do you need to do? 3 years experience in operational and process improvement. Has previously worked in the field, that'd be good. Has gained experience across allocation and logistics roles. So you need 3 years experience in allocation and logistical roles to earn 11 grand a month for the NHS. Good data analysis skills, so you can use a spreadsheet. Remains calm under pressure, because we all know that when it comes to the NHS, you're probably under the most pressure if you're an NHS Test and Trace operational improvement manager. Has the ability to work at pace on a range of competing projects and is comfortable with a high pace of change. I presume that means running around chasing your own tail. It's a 6-month contract, probably renewable, I suspect. Full-time, £550 a day plus benefits, 11 grand a month, 130 thousand pounds a year. For doing what? Managing a process. That's what managers do, is manage a process. There are 7 of you. Presumably you're all being told by somebody above you what to implement, and then the 7 of you regionally have to implement a test and trace process. Now this is a new position as of the 30th of August 2021. So the process is already in place. All you're doing is presumably improving it or expanding it. 130 thousand pounds a year. 3 years experience in logistics. If you work in logistics, and this isn't a very high level job, if you're working in logistics, you ought to be looking at this. 130 grand a year. I bet, what are you earning at the moment? 50? 60? Let's have a look, shall we? This is now real day, present day, 2021. This is on the NHS website, as you'd expect. Clinical oncologist, consultant anaesthetist, lead anaesthetist, anaesthetics consultant, all on sort of 100-ish grand. 90 to 120 grand. I would argue that if you're an accomplished consultant or surgeon, you ought to be earning more than 100 or 120 grand a year. I think there's an argument to say that you're worth more than that. Now, of course, a lot of these people also work privately. So they will work for the NHS and then they will have a little sideline in a private hospital where they earn considerably more again. So you'd have to look at it. But I mean, I don't resent qualified professionals earning that sort of money, especially when they're health professionals in the health service. Let's have another look. This is NHS again, various jobs. Chief Digital Transformation Officer, 112. Regional Finance Director, 130. Regional Director of Finance, 130. One for Manchester, one for Derby. Regional Director of Finance, London, 130. All this duplication for what are relatively non-jobs, because they've got a whole board and a chief executive above them, and they will only be given a certain amount of money. They're a monopoly with a fixed amount of money to spend. So a regional finance director is basically counting numbers. Executive Director of Nursing Quality, good, okay, you presumably need that, but again, for just Dudley Integrated Health Trust. So what about all the other trusts where they do exactly the same thing? Chief Digital Transformation Officer again, and another one. What are these people actually doing? And why do we need so many of them? And why are they all being paid so much money? Why don't you have a half a dozen people who are actually good at really important people at doing stuff and know what they're doing, and then centralise that and then just implement it on a much... You don't need to be on 112 grand a year to implement digital transformation. I mean, this is just a total waste of money. Deputy Director of Personalised Care. I have no idea what the Deputy Director of Personalised Care means, but it presumably means there's a department underneath him providing personalised care. I thought all health care was personalised care. Deputy Director of Nursing, Theatres and Anaesthetics. Okay, fair enough. Group Chief Delivery Officer. Well, what's a Group Chief Delivery Officer? Assistant Director, Planned Care and Transformations. A lot of transforming going on here, isn't there? Any big company that's failing is constantly in flux, transforming, changing names, and has jobs which mean nothing. Managing Director, Chief Medical Officer, Chief Operating Officer, all for different areas of London or the regions. All duplicated, all on 100 grand a year. 190 grand a year, 103 grand a year, 100 grand a year, 115 grand a year, 108 grand a year, 200 grand a year. Executive Director of Nursing and Quality. Chief Exec, 200 grand a year. Head of Patient Relations, presumably that's something to do with dealing with complaints. But otherwise, why isn't everybody working in the NHS dealing with patient relations? You are dealing with patients. Wellbeing and Inclusion Advisor. Radiology, fine, okay, radiology. And look at the salary now, 38 to 40 grand for radiology, actually a medical thing. Head of Staff Experience and Inclusion. Staff Experience and Inclusion, 50 grand to be head of a department to do with staff experience and inclusion in Chester alone. What do you do? Annual delivery, that's all management speak. A busy role which will deliver measurable impact in these key areas. You need to be equally comfortable and adept at strategy development, as well as having a current knowledge of relevant legislation and reporting requirements under the inclusion agenda. Inclusivity, I see. Information distributor. Health and well-being program. Operational manager, neonatal. Yeah, okay, neonatal, I suppose. You know, that's a healthcare, isn't it? Lots of project managers, support workers. As the salary goes down, the actual validity of the job goes up. So most of the people doing what you would consider to be work required, deputy head of midwifery. Okay, so she's head of midwifery, so it's not on the, still an office job, but I guess there has to be somebody head of midwifery to support that department and manage it. Theatre support worker, 19 grand a year as a theatre support. So that's the first, we're getting somewhere now where, other than doctors, where people are actually doing stuff in the NHS, 19 grand a year. You can be on 130 grand a year to be one of about 35 change implementation fucking officers. Head of sustainability for Hereford alone, 62 grand a year. The level of waste here, just from one quick Google search, is astounding. And this is waste duplicated through every region, and then on top of that, further duplication of all of this admin at Whitehall level. And then, of course, you've got this. I've just picked this up. Just one quick search. This guy, April 2021, held 3 senior NHS positions at the same time. And his employer didn't even know that he had those 3 jobs. How do you have 3 senior full-time positions for the same employer and no one know?